Hello everyone, it's me again, Alona, your nurse educator today. So today, it's going to be another interesting day na isi-share ko sa inyo kung ano man yung mga inquiries or breastfeeding problem. Okay, so breastfeeding tayo ngayon. So, my moms who messaged me privately, I mentioned it to you before about this mom had been breastfeeding for 2 years at gustong-gusto na niya nang mag-wean off, mag-stop ng breastfeeding. So, after all our chat, message siya, nag-exchange kami ng messages, ginawa niya yon. So, i-share ko lang sa inyo kung ano yung outcome. So when she started weaning the baby that day, talagang super engorged siya na sobrang sakit na yung breast niya. Okay. I-share ko sa inyo to dahil baka mangyayari sa inyo when it comes to kung mag-decide na kayo na tama na, 1 taon na o 2 taon na, hindi na ako mag-breastfeed. So, ang nangyari, hindi talaga niya natiis. Sobrang sakit. Talagang nag-breastfeed siya a few times para maibsan, mabawasan yung fullness, yung engorgement ng breast niya. She followed all my advice na to put a cold pack doon sa breast niya nung talagang nag-super engorged na, ginamit niya cold pack. It works a little bit. Hindi naman super na magic na ma-relieve ka agad. Gawa ng, could you imagine, you've been breastfeeding for 2 years and then suddenly nag-stop ka. So yung milk mo, na-shock din, right? So, ang lesson na share ko sa inyo, if ever it happens to you, na kahit nag-breastfeed kayo and then you want to travel somewhere, malayo ka sa baby mo for even 6 hours or 5 hours, it can happen to you na mag-super engorge kayo, okay? Na I remember one of my patients, isa sa mga pasyente ko, she went out of town for 2 days, she and her husband, naiwan sa baby sa yaya. The worst thing was, during that time, when she left, naiwanan niya yung breast pump. So, she was shopping at the mall, she was going everywhere in the city, and then suddenly, during the night, hindi na niya mahawakan yung breast niya. Sa sobrang engorged, sa sobrang sakit, umiiyak siya sa akin sa phone. She called me and she said, Alona, hindi ko malaman, I don't know what to do. I'm very engorged, I'm in pain, I don't know what to do. Nag-chill na daw siya, feeling niya may headache na siya. Like, it could happen to anyone kasi marami siyang gatas eh. So, ang payo ko sa inyo, if ever that happens to you na super engorged kayo, masyadong masakit, wala si baby, wala kang breast pump, you have to do something. You have to do something to relieve that pressure. You have to do something to remove that milk. At I think na-mention ko ito before, well, the husband was there. The husband helped her remove the milk. Hindi ko na i-elaborate kung paano, okay? Siguro alam niyo na. But if you can massage it manually, help, the partner should help, express it manually, save the milk. If there's a fridge in your hotel or wherever you are, you can save the milk just to relieve the pressure. Kasi you know what would happen? Let's say you're gone for 2 days. Nag-i-engorge ka, hindi mo malaman paano yun express. Yes, may natitira pa, medyo naibsan yung konting pressure, and then suddenly, pag uwi mo ng bahay, your milk declined, meaning bumaba yung supply mo. Of course, for even few days na hindi mo stimulate yung breast mo, again, sinasabi ko to before, it always tells your brain to stop making milk pag walang ginagawa dito. The brain would always say, okay, well, ini-ignore mo ang milk ko, I'll stop. Hindi na ako gagawa ng more milk. So, ganun kasensitive yung production natin. Kahit sasabihin mong 6 hours, hindi ka nagbe-breastfeed, kung kini-continue mo yun every day or every other day na medyo nagre-rely ka sa mixed feeding mo, nagre-rely ka sa bote, and then you said, oh, siguro bukas na ako full stimulation sa breast ko. Believe me, within weeks, makikita mo talaga ng difference ng milk supply mo. Unless, isa ka doon sa mga super breast producer na kahit siguro 1 day or 2 days hindi nag-stimulate yung breast, marami pa rin gatas. Only few lucky ones sa experience ko sa aming breastfeeding clinic. So, again, baby should be the one who regulates your milk supply. It should be the baby. Lalo na pag si baby older na, baby is healthier, walang complication. You don't even have to pump all the time. You don't even have to express all the time unless gusto mong mag-store ng milk sa fridge mo. But baby should be the one to regulate your milk. Hindi ang breast pump, hindi ikaw. It should be the baby. Depende again sa appetite ng baby, at sa strength ng baby, at sa health ng baby, okay? Pero kung yung strength ng baby, health ng baby, at stamina ng baby is weak, you have to do something to maintain this. Either you pump, you massage, you express, do everything you can, and eat good. Without eating good, mga nanay, without eating good, it can affect your milk supply. So I hope naliwanagan kayo doon sa pangalawang tanong for the day. So yun ang pinaka-importanting isipin nyo na it's always good to pay attention to the baby's needs. Pay attention here. Pag napifeel nyo, nighttime, medyo napahaba yung tulog ko, ang tigas-tigas na, ang dami ng gatas. I know it's hard, but 10 minutes to pump it out or express it or feed the baby at night will help you maintain your milk, okay? Take note, ang baby, ina-advise ko ang mga baby up to 3 months or 4 months, yun, kailangan talaga mag-feed si baby during the night. Pero pag older na si baby, nagsimula ng kumain ng supplementary food, then you maybe breastfeed the baby before you go to sleep, and then when you wake up in early morning, you can do that. Pero for now, na newborn pa si baby needs all the fat of the milk, all the milk that the baby needs, kailangan maibigay mo, okay? If you're supplementing right now, I have no problem with that, okay? Kalimitan sa mga lactation consultant, they really push so much on breastfeeding. Yes, I am a breastfeeding educator and an advocate. Pero naiintindihan ko yung mga sitwasyon ng mga nanay na hindi na nila malaman kung saan sila kukuha ng milk supply nila dahil alam nilang kulang sila. There's some issues with them, maybe anemic sila, kulang sa pagkain, laging pagod, na kailangan talagang isupplement sa baby. And baby needs the milk, okay? Whichever way you can get milk, breast or formula, kung iyan ang kailangan ni baby, we have to feed the baby. So, hindi ko ginajudge sa mga nanay dyan na nag-mix feeding o nag-formula feeding. You know what? You've done so much for your baby. Hindi biro ang maging nanay o maging tatay. So, kudos to you. Take care of yourself. Take care of your baby. And if you do have any questions, fire it. Talagang mention it. You do your comments. You can message me privately. Dahil alam nyong napaka-busy ang nurse educator nyo. Sinabi ko before that I do so much training with DepEd. I do so much mental health training. I created programs. So other than my breastfeeding and lactation consulting YouTube channel, outside of this, I teach online. So I'm a busy woman, but I make sure na magagabayan ko kayo kung may mga bago kayong mga babies ngayon or older babies. Magagabayan ko yung mga estudyante na nangangailangan ng tulong. So if you have any questions, concerns, you have comments on this, don't forget. So another thing that i-address ko, question number 3, na kasi natapos na natin yung 1 and 2. Itong nanay na to, itong baby, ginawa na niya lahat, pero hindi pa rin maglalatch si baby. Nai-stress na po ako, hindi ko malaman anong gagawin. Please help. So, again, I did this video on how to train the baby to fall in love again of your breast. Please watch that. Also, dito sa relatching the baby, kailangan talagang may patience tayo. Kasi itong baby na to nag-i-struggle din, kaya nag-quit. There's a reason kung bakit itong baby na to hindi nag-latch. Maybe mali yung paghawak sa baby, hindi komportable si baby. Maybe bundle si baby, may lampin, may sweater, may medyas, may kung ano-ano. Number 3, maybe you don't have enough milk at si baby na feel na tuwing sak ni baby wala siya makukuha, mag-quit na lang siya. Number 4, napakainit siguro ng bahay nyo o napakaingay ng bahay nyo. Number 5, siguro something you ate na nabago yung lasa ng milk mo na ayaw ni baby. Okay? So, or number 6, ang dami kong reason na nagbabago ang behavior ni baby. Minsan nagbabago ang behavior ni baby 3 months. Nagbabago ang behavior ni baby ng 6 months dahil sa growth spurts. So itong mga risk factors na to kung bakit si baby biglang umayaw. Nagulat si mom, biglang umayaw, ayaw dumede. It are because of these risk factors, the causes on why this baby is not interested to latch. Babalik at babalik din. May kanta yun eh. Babalik at babalik din. Pero unti-unti mong i-train. Kasi hindi basta-basta din na maibabalik mo yung desire ni baby to breastfeed. So, unti-unti, bote, and then switch sa breast. Unti-unti, express mo ng milk mo, rub it around the baby's gum, let the baby suck your finger, switch to the breast. Okay, watch that video that I've created on how to help baby latch. Those babies who are refuser, ayaw na ayaw mag-latch. Watch those dahil it will really help you. And again, hindi magic, okay? It may take days, it may take weeks bago pa itong baby na stubborn baby na to na ayaw mag-latch, matututong bumalik uli and fell in love at your breast. Don't get stressed. Itong lagi ko sinasabi, every time you stress out, tataas na naman yung cortisol hormone nyo. Matatalo na ngayon si cortisol, matatalo si oxytocin hormone. Kasi itong cortisol hormone na to, sa stress hormone na to is very powerful eh. Matatalo si oxytocin. Ang oxytocin ang nagbibigay sa atin ng maraming milk. So, wag tayong patalo ni cortisol, si stress, okay? Pag nagpatalo kayo, na-stress kayo, nadadala kayo sa frustration, lalong bababa at bababa ang milk nyo, lalong aayaw si baby. Si baby, gusto ni baby instant gratification. Alam niyo ba kung ano yun? Na pag na-daddy ako, nandoon ka agad yung gatas. Huwag niyo akong pahintayin. I need the milk. Pag walang milk within 5 minutes, ayaw na ako. Ayaw ko nang mag-latch. Sayang pagod ko. Ganon ang mga babies ngayon because they are the boss. You cannot force them. Okay? When you force them, you fight with them. When you fight with them, lalo kang may stress. So, that's it for the questions. I think nasagot ko mga comments nyo. More to come. Okay, more to come. I hope you learned something from this video. So, stick around, share this video, subscribe, and once you share this, could you imagine kung isa kang nanay ngayon, i-share mo itong video na to, ilang nanay ang matutulungan mo? Without knowing na nakatulong ka. Okay? Pareho tayo. Okay? Ang layo ko sa inyo, but I'm able to share kung ano yung kaalaman ko. Okay? Kasi mahirap eh. Karamitan walang perang to pay for a lactation consultant at mahirap ka rin maghanap kung saan ka makakuha ng lactation consultant sa ating bansa. Okay? So I'm here, your lactation consultant, ready to help you. So give me a thumbs up. Bye for now.